Remember last week we were at Dr. Spencer's office talking about BrainCore therapy. Well, this week I'm actually going to have my brain mapped.
Yes.
And figured out. So, and it's painless. So we're going to put the cap on me now. I'm going to hold this here.
You look so cute, Jim, already.
And it fits that bald head easy, doesn't it?
It does. You shaved your head just for us, right?
Yes, I did.
All right. We got all the sensors in the right place, and it's actually going to map all the areas like we talked about last time where we have the sensors. And what's going to happen is this little cord right here is going to give us some feedback into our machine here. And Susan is going to hook you up and begin this painless test.
Okay.
And we're going to find out if you have global or focal dysregulation, like we talked about, that may be contributing to your stress and anxiety.
Okay.
Are you ready to get the test started?
I'm ready. Let's do this.
Okay. All right. Well, what Susan's going to do is hook you up and put some sensors on your ear. And again, this puts no electricity at all into your body. What it does is it reads the electrical activity that's already present going on in your brain, looking for brainwave activity in the 4 different brainwaves: alpha, beta, delta, and theta. Okay? And we're looking for dysregulation on all these sites like we talked about.
Okay.
So what I'm going to do is step out and let Susan do her magic, and when we are done, we're going to come back and give you your results. You excited about that?
I'm excited. Let's do this.
All right. Well, Susan's going to hook you up.
All right. So Susan hooked me up with the cap and everything, and then she ran 2 sets of tests on me. One set for 6 minutes, and it's 6 1-minute tests with my eyes closed. And the second set, 6 minutes, 1 minute each with my eyes open to try to map out and get my brain report. So now Dr. Spencer back in here with me, talk about my results.
Yes, Jim, we're going to talk about your results. So here is the results of your QEEG or your brain map results. This is a summary of your brain map, and these are all the sites that we tested. The sites in red here are your most dysregulated sites. The C3 and C4, and P3 and P4. Now that does not mean that the sites in green are normal. It means that the red sites are the most dysregulated. Similar to if you had a forest fire, you would have hot spots in that fire.
Right.
So the red spots are the hot spots.
Okay.
Yes. So in looking at global dysregulation and the meters here, you have an 85% probability that you have beta dysregulation. Remember we talked about the 4 different types of brain waves.
Right.
So your primary symptoms that you were coming in here for to see if you had dysregulation were anxiety and stress. So anxiety is the #1 symptom right here for beta dysregulation. Some of the other things that could show up here are worry, obsessive thinking, restless, dislike change, some of those things. It's a brainwave that is associated with fast processing and so forth. So you have a match between your symptom and your brainwave dysregulation. So that means that you would be a candidate for neurofeedback.
Okay.
And based on that, you would probably respond well. Now, looking at your focal site dysregulation, some of your symptoms that you reported also match the spots on your brain that are associated with different symptoms. For example, if we look here at anger, agitation, irritability, those are sites, those are symptoms where you have a site dysregulation going on. And so what we do is the brain map tells us, since it tells us where the most dysregulated sites are in your brain, we know exactly where we need to train your brain in order to correct the dysregulation of brain waves.
Okay.
There's a lot of other stuff going on here with your brain. In looking at alpha and beta, for alpha dysregulation, for alpha, all of the alpha should be on one side of the brain.
Okay.
Let me show you that, Jim. For alpha dysregulation, a normal shift in the normal asymmetry of alpha, higher alpha on the left at one or more sites. Okay? You have that here.
Okay. Is that good?
No. No. You would want that spot to be right over here.
Oh, okay.
But look at the beta. A shift in the normal asymmetry of beta, higher beta on the right at one or more sites. Look at all the sites where you have high beta. All of that should be on the left side.
So my brain is backwards.
Exactly. So all of your high beta should be on this left side.
Okay, but it's on the right side.
It's on the right side. So when we train your brain, we're going to be working to shift this asymmetry about beta. And again, that's the number one component that showed up on your dysregulation is the beta asymmetry.
Okay.
And that's the number one thing that we would focus on.
Okay.
Also,
We've got a little bit more than a minute left.
okay, and looking at this map here, you have very high magnitudes of beta going on here, extremely high. This should be completely green where it says okay. So very high magnitudes of beta are again associated with those symptoms that we just discussed. So again, neurofeedback is great for all sorts of neurological conditions that people have to take medications for long term. You're not taking medication for stress and anxiety, which means that neurofeedback works much faster for you than someone who's over-medicated or taking a lot of medications. Your brain is easier to train when you're not medicating it. That doesn't mean that neurofeedback doesn't work for people who are on medication, but this is used by lots of major researchers and is available right here now in Gulfport, Mississippi in our office.
Well, we're going to come back on another day and show you what kind of exercises that my brain needs to do to try to get it swapped. Anyway, thank you so much, Dr. Sonya Spencer. You really need to come check this out. This is amazing. It's for kids and adults. Come talk to them at Dr. Spencer's office.